The headache that would not go away started in July of 2010. We just had a birthday party for my uncle and the day before and was having a good time, and then the next morning I woke up and my life completely changed.
Can you talk about all the medicines that you were on?
By the time I got to Dr. Kapoor, I was on upwards of 30 types of medicines a day, and obviously, you take 2, 3, 4 tablets a day of each type. So I was on medicines for high blood pressure and seizures, epilepsy type medicines, just every type of headache medicine that you can imagine, but none of them were working. Nothing was working.
So headache is quite complicated, and the management of a headache patient, while stress is an important contributing factor to worsening of headaches, the overall most prevalent headache disorder is a migraine disorder. A migraine disorder is characterized by a genetic vulnerability of patients to suffer with migraine headaches under the right circumstances. The people who are best able to evaluate and treat headaches, especially migraine headaches, are neurologists. It is while headaches are a very important reason to seek attention from a medical doctor. In fact, it's one of the top 5 reasons to go and see your primary care doctor. This is what neurologists do. What is also not very well known is that almost three-fourths of neurologists actually suffer from headaches themselves, and are very able to empathize with the patients and deliver care with compassion and understand what their patients are actually going through. So they can evaluate the patient and offer them advanced treatment options.
Before getting to Dr. Kapoor, I had been to see several different neurologists throughout the Lexington area and even out of state. And every doctor that I've seen either treated me as a number to, just come in 5 minutes and out the door, or they tried to just throw me on additional pills, which obviously wasn't working, or I even had some doctors recommend some pretty invasive surgeries. So being able to become headache-free with a less invasive surgery has really opened my eyes to the point that I really recognize how important it is for other people to know that, getting to the right doctor is the key.
So what can you do now that you couldn't do before?
That's a loaded question. Before, I was having so many passing out spells from the headaches that I was not able to drive, and now I've been driving for the past 18 months or so, or more. I'm now able to go to Zumba classes. I can go out to eat at a restaurant without having to worry about the noise level getting too high and having to get up and leave. I teach a health class at church because health is really important to me at this point, because I have lived in a state where, my health was deteriorated, and so to be able to live like a normal person is quite enlightening.